Diabetes is a common disease. It affects how your body uses sugar. Sugar is also called glucose. Glucose is important because it gives energy. Energy is needed for daily activities. It's important to understand diabetes. Many people have it. It affects millions of lives. Understanding it can help you stay healthy. It can also help you help others. Diabetes comes in different types. Each type is different. Knowing the differences is important. It helps in managing the disease better. In this essay, we will discuss diabetes. We will look at what causes it. We will talk about the two main types. We will also look at how to treat them. Finally, we will share some useful facts. Diabetes happens because of problems with insulin. Insulin is a hormone. It helps your body use glucose. When insulin does not work right, glucose builds up. This causes high blood sugar. There are different reasons for this. Sometimes the body does not make enough insulin. This is one cause. Another cause is when the body does not use insulin well. Some people are more likely to get diabetes. This can be because of their genes. If your parents have diabetes, you might get it too. Lifestyle can also be a cause. Eating too much sugar and not exercising enough can lead to diabetes. Other factors include age and weight. Older people are at higher risk. Being overweight also increases the risk. Knowing the causes can help you prevent diabetes. There are two main types of diabetes. They are type 1 and type 2. Each type is different. They have different causes and treatments. Type 1 diabetes usually starts in children. It happens when the body cannot make insulin. The immune system attacks the insulin-making cells. This is why it is also called an autoimmune disease. Type 2 diabetes is more common. It usually starts in adults. In this type, the body cannot use insulin well. Sometimes the body does not make enough insulin. This type is often linked to lifestyle factors like diet and exercise. Knowing which type you have is important. It helps in choosing the right treatment. Both types need management, but in different ways. Type 1 diabetes has clear symptoms that can be easily recognized if you know what to look for. One of the most common signs is feeling very thirsty all the time, even if you drink a lot of water. Another sign is needing to pee a lot, which can be especially noticeable at night. People with type 1 diabetes also often feel very tired and fatigued, even if they get plenty of sleep. They might lose weight without trying, which can be alarming and confusing. These symptoms can come on quickly and may seem to appear out of nowhere. They often appear in children or young adults, but can occur at any age. If you notice these symptoms in yourself or a loved one, it's important to see a doctor as soon as possible. The doctor will perform tests to check your blood sugar levels and confirm the diagnosis. A common test is the fasting blood sugar test, which measures your blood sugar after you haven't eaten for a few hours. You cannot eat for a few hours before the test to ensure accurate results. Another important test is the A1C test, which provides a picture of your average blood sugar levels over the past few months. This test helps doctors understand how well your blood sugar has been controlled over time. If you are diagnosed with type 1 diabetes, you will need to take insulin to manage your blood sugar levels. Insulin helps your body use glucose for energy and keeps your blood sugar levels in a safe range. You will also need to check your blood sugar levels often, using a glucose meter or continuous glucose monitor. Keeping track of your blood sugar levels helps you and your healthcare team make informed decisions about your treatment and lifestyle. Section 5. Type 2 diabetes. Symptoms and diagnosis. Understanding the symptoms and getting a proper diagnosis is crucial for managing type 2 diabetes effectively. Type 2 diabetes has a range of symptoms that can significantly impact daily life. These symptoms are often similar to those of type 1 diabetes, making it essential to pay close attention to your body. Feeling excessively thirsty, known as polydipsia, and constantly tired or experiencing fatigue are common signs that should not be ignored. Another frequent symptom is the need to urinate more often than usual, called polyuria, which can be particularly disruptive. Some people may also experience blurred vision, which can affect their ability to perform everyday tasks. The symptoms of type 2 diabetes tend to develop gradually, often going unnoticed for a long time. Sometimes these symptoms are not noticed for years, leading to a delayed diagnosis. Many people do not know they have type 2 diabetes until they experience more severe health issues, such as neuropathy or cardiovascular problems. That is why regular checkups and monitoring are so important for early detection and management. Doctors use a variety of tests to diagnose type 2 diabetes accurately. The fasting blood sugar test and the A1C test are among the most common diagnostic tools. Another important test is the oral glucose tolerance test, which measures your body's response to sugar. In this test, you drink a sugary solution, and your blood sugar levels are checked after a few hours to see how your body processes it. If you are diagnosed with type 2 diabetes, making lifestyle changes is essential for managing the condition. Eating a balanced diet and incorporating regular exercise into your routine can significantly help control blood sugar levels. In addition to lifestyle changes, some people may also need to take medication to manage their diabetes effectively. Managing your weight is another crucial aspect of controlling type 2 diabetes, as it can help improve overall health and reduce complications. Section 6. Treatment options for type 1 diabetes. Type 1 diabetes needs insulin treatment. Insulin can be taken in different ways. Most people use insulin injections. These are given several times a day. Another way is through an insulin pump. This gives a steady amount of insulin. Checking blood sugar levels is very important. This helps in knowing how much insulin is needed. Blood sugar levels can change throughout the day. They can be affected by food, exercise, and stress. Eating healthy is also important. Carbohydrates affect blood sugar levels. Knowing how to count carbohydrates can help. Regular exercise helps in managing blood sugar too. Education is key. Learning about diabetes helps in managing it better. Many people attend diabetes education programs. These programs teach how to manage the condition. Section 7. Treatment options for type 2 diabetes. Managing type 2 diabetes effectively requires a comprehensive approach that includes lifestyle changes, medication, and regular monitoring. Type 2 diabetes can often be managed with lifestyle changes. This means incorporating regular physical activity and making healthier food choices. Eating a balanced diet is important. Focus on consuming a variety of foods that provide essential nutrients. Foods high in fiber and low in sugar are good choices. Regular exercise helps too. Activities like walking, jogging, yoga, and group exercise classes can be beneficial. It can lower blood sugar levels and help in losing weight. Monitoring your weight and blood sugar levels regularly can provide valuable insights into your health. Some people may need medicine. Medication can be an essential part of managing type 2 diabetes, especially when lifestyle changes alone are not enough. These medicines help the body use insulin better. They work in different ways to keep blood sugar levels under control. Metformin is a common medicine. It is often the first medication prescribed for type 2 diabetes. It helps lower blood sugar. Metformin works by reducing the amount of sugar your liver releases into your blood and improving your body's response to insulin. There are other medicines available too. These include sulfonylureas, DPP-4 inhibitors, GLP-1 receptor agonists, and SGLT2 inhibitors. A doctor will decide which is best. Your healthcare provider will consider your specific needs and medical history when prescribing medication. Sometimes, people with type 2 diabetes also need insulin. Insulin therapy may be necessary if other treatments do not adequately control blood sugar levels. This is more common if other treatments do not work. Insulin can be administered through injections or an insulin pump. Checking blood sugar levels is important. Regular monitoring helps you understand how well your treatment plan is working. It helps in knowing if the treatment is working. Support is also important. Keeping a log of your blood sugar levels can help your doctor make necessary adjustments to your treatment. Many people find it helpful to join support groups. These groups provide a platform to share experiences and learn from others who are managing the same condition. These groups offer advice and encouragement. They can be a source of emotional support and practical tips for managing diabetes. They can be a good place to learn from others. Engaging with a community can make the journey of managing type 2 diabetes less isolating and more manageable. Section 8. Additional useful facts about diabetes. Diabetes can cause other health problems. These are called complications. High blood sugar can damage blood vessels. This can lead to heart disease. It can also cause kidney problems. Eye problems are also common. High blood sugar can damage the eyes. This can lead to blindness. Regular eye checkups are important. Foot problems can also happen. Poor blood flow can cause foot sores. These sores can be hard to heal. Taking care of your feet is very important. There are ways to prevent or delay diabetes. Eating healthy and staying active are key. Regular checkups can catch problems early. Knowing your family history can also help. If someone in your family has diabetes, tell your doctor. Section 9. Conclusion. The importance of managing diabetes. Diabetes is a serious condition. It affects millions of people. Understanding it helps in managing it better. Knowing the causes and types is important. It helps in choosing the right treatment. Type 1 and Type 2 diabetes are different. Each needs different treatments. Lifestyle changes can help manage Type 2. Insulin is needed for Type 1. Both types need regular checkups. Managing diabetes can prevent complications. Eating healthy, exercising, and checking blood sugar levels are key. Education and support are also important. In conclusion, understanding diabetes is important. It helps in staying healthy. It also helps in helping others. Managing diabetes well can lead to a better life.